Leslie Thompson at the 2009 annual meeting for the American Society for Aesthetic Plastic Surgery, and I'm joined by Dr. Julius, based out of Chicago. He is a board-certified plastic surgeon, and you are the chair of the Cosmetic Medicine Commission for ASAP. So thank you very much, Dr. Few, for joining us.
Thank you for having me.
Well, I know that you were part of a panel on rhinoplasty here at the ASAP's meeting, and I'm curious to hear from you what some of the new trends are.
Well, I think that the kind of exciting trend that we're seeing right now is actually there's a growing interest for people who are from different ethnicities wanting to improve the appearance of their nose. And the thing that we're realizing is that it's more important than ever to look at very, very specific components or traits that make, for example, an African American nose look African American versus Asian versus Latin. So I think that we're seeing an exciting time, and really it boils down to customizing the result.
What are then some approaches in terms of maintaining the ethnic features and yet scaling them back? How do you find that proportion when you're dealing with somebody with ethnic features and yet they obviously want to downplay them?
Right. The magic answer, at least one of the magic answers in my experience, has been using photographs of other family members.
Oh, okay.
So a lot of times people will come in, men and women will say, you know, I would be happy if my nose was more like my mother or more like my brother or my father. So that really helps to kind of guide things. And it really, when we talk about facial beauty, it all centers around balance or proportion. So if somebody's nose is too big, it may be too big for their face, but on somebody else's face it may be perfect. So that's really the way that we're looking at things.
Now, my understanding is that actually Hispanic, African American, and Asian communities, those are the fastest growing demographics for facial cosmetic surgery. Any sense of what may be driving that trend?
First of all, you're absolutely right. That is the fastest growing demographic, and I think the reason for it is in part because these groups understand that as a specialty, as board-certified plastic surgeons, we are constantly striving to be the best that we can be and to offer the most for their ultimate benefit. So right now, it's very clear in this community, and based on talks like what we just participated in at this meeting, that we're interested in every little component of rhinoplasty and facial aesthetic surgery and being at the cutting edge. So I think that's in big part the reason.
Excellent. Okay. Give us the inside scoop. Celebrities who come from different ethnic backgrounds, who maybe had some face work done, because there's always been speculation about Jennifer Lopez. You look at pictures of her from back when she was on Living Color, and she had a somewhat broader nose, and you don't know what's been done with makeup and what may have been done with surgery. Any other celebrities that you think fall into that category?
Well, I think everybody knows of Michael Jackson. That has been a very public kind of disclosure. I think that there are a number of other individuals who you could possibly suspect. I have seen questions of whether Jessica Alba may have had something done. I think that the bottom line is the reason that there's a question is that the techniques have gotten that much better to the point where it's not obvious. You have to wonder. Did she or didn't she? And that, I think, is a credit to the specialty. It's a credit to the level of work that we're doing.
And then there are people like Ashley Simpson, who was very forthcoming with the fact that she had a rhinoplasty, and yet it doesn't look out of proportion or anything. It was very well done. It's just she needed to come clean about it because it was going to be a very obvious change for her.
That's right. That's right. And I think you touched on something that also is important, and something that I see in ethnic patients that is a little bit different as compared to people who are coming from more of a Caucasian background. And that is, in the ethnic groups, they want changes, but not in-your-face changes. So, again, balance, but not trying to change who they are. I think that's important.
So if someone is looking for for a cosmetic surgeon, and perhaps specifically for rhinoplasty? What does a patient need to look for as they're doing their research?
I think the key is starting with a board-certified plastic surgeon certified by the American Board of Plastic Surgery. I think that if they want to go a step further, looking at organizations such as the American Society for Aesthetic Plastic Surgery, because there is ongoing continuing medical education, and then ultimately ask their surgeon if they have experience with ethnic rhinoplasty. What I found is that surgeons are very, very honest about the fact of their experience. And I've had patients referred to me from Iowa. I'm in the Midwest, as you said. So I've had patients referred to me from Iowa, for example, because the plastic surgeon in their neighborhood had never performed an ethnic rhinoplasty, in particular an African American rhinoplasty, so they referred them to me.
Interesting. So. Great. Well, thank you so much, Dr. Pugh, for sharing your time. And thank you for joining us today. I'm Leslie Thompson for the Plastic Surgery Channel.